Good morning, all. So I want to address shoulder issues today. Shoulder issues can come in all kinds: rotator cuff, tendinopathy, tendonitis, labrum, AC joint, you name it. Those are the most common ones. Rarely arthritis of the shoulder. You'd be surprised. It's not. And when it goes down, it's gone down. And it's hard to do anything with. But those are most of them soft tissue related. Biomechanics get screwy. But everybody, I hurt here, but that ain't where it actually came from. You ultimately put strain on your rotator cuff, and we'll stick with that now, or your labrum, and a lot of this you predisposes the postural. And I'm going to show you a few things that will lend you to a high probability of hurting your shoulder, or your shoulder's already hurt, and then you're going to look in the mirror and say, I see what he's talking about. Point is, posture makes a difference. And then let's lay the groundwork for this. So you can go look in the mirror, and can you see the back of your hands? All right. That already means that your shoulder's rotated, what we call internally, and already binding up the tendon. That's already happened. That's happening on a daily basis. So ideally, posture should be with the thumbs pointing forward. And I'm kind of squeezing my back muscles a little bit right now. I'm not doing this. I'm just squeezing my shoulder blades. Right. The more I squeeze them, the more this happens. Posture. You know it. You see it. Range of motion's decreased when you do this. Hands are rotated forward. Traps are engaged constantly. 24 hours sitting at a desk. Oh, this. Whatever you're doing, construction. Here. So our back very rarely gets any treatment unless it starts failing and you go see somebody. But it's a cumulative thing that makes you very susceptible to rotator cuff problems. So your posture is where all the rehab is. And all exercises are based on getting, not necessarily just working the tendon. And there are thousands of exercises for that. Thousands of exercises. You can look those up. And all of them have the same concept. But the paradigm of getting a shoulder truly better is we got to get the cause. All right? And so the cause is we're constantly using these traps which lift. And if you ever had a rotator cuff problem, that's all you do. You lift with your traps because these don't work. So point is I'll show you a simple one called Brugger's. I give this a lot, but it's the concept because all the exercises are based off of this, or the concept of, or something like it. And so we just put your hands behind your back. All right, you can grab your finger, or you can put them together and clasp them like so if you can. So these are just daily exercises that are to be done. They're easy, you don't do them long, but they engage your back muscles. So I'm squeezing my glutes. Heard that concept before? All right, shrug, squeeze. Pencil between your shoulder blades. Push down. That's a key element. Push down. If you can't do that, bring your hands out. So let's do that again. Thumbs facing. Hands out if you want to do it. Shrug. Squeeze. Squeeze your butt. Push down. Reach for the floor. Reach. You can feel some muscles engaging you haven't touched in a long time. Those are truly the shoulder muscles. Those muscles engage and get you back. You cannot sit there all day and just keep trying to work on your body. That's impossible. You've got to engage the muscles and start the process. So this is Brugger's exercise. Let's do it again. Shrug, squeeze, push down. Grab your hands, whatever you're going to do. Push down, squeeze your butt. Squeeze, hold. 15 seconds. Whoa, that's not a lot to ask. Do that when you're sitting. Take your breaks every hour or so. Get up and do it. And if you want more exercises, there are plenty of them out there. We can go into it. There are thousands, but they're all based on squeezing your shoulder blade, doing whatever. But but they're all based off of the concept that I just told you. For instance, going to the gym, seated rows. Please quit shrugging. Squeeze. All right. Here's another. I got to touch on this. So you guys that go to the gym, drives me crazy seeing you in there because you're fit and all this, or old or whatever, and I see a problem that most everybody's doing that drives me nuts. And I tell them, a lot of patients this, and they get it once they start. So let's do a seated row. Oh, okay. So if I stop you there, all you're doing is shrugging and working a muscle that you work about 24 hours a day sitting at the office. Or shrug, 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 shrug. Get your elbows down, squeeze. Just saw that before, bro. No shoulder, no traps. Here, all right. So with that said, you do it when you go pull your lats down. When you do your lat pull downs. What are we doing? Watch it. Just watch it. And you'll become aware of this when you do this at the gym. And rows. Shrug, 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 shrug. It's all we do. Do the exercise without shrugging. It will engage the muscles you're trying to work. Everything from, you name it. Every kind of exercise, lateral rows, whatever. Shrug, 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 shrug. Get the traps out to play. We need this back here, middle of the scapula working. That's the concept. If you engage that concept, your workouts will be better, and your posture will be better, and your shoulder, the possibility of you getting injured goes down. All right, have a good day.